And for today's personality, we are going to talk to a very brave, courageous young man who has not only survived coronavirus once, but twice, and is bold enough to share his story with us. If you guys have any questions for him or comments, please let us know with the hashtag BreakfastDaily in the WhatsApp line 0550-585832. If you're outside Ghana, please use the country code +233. And we are having this conversation because there are still people out there who don't believe the virus is real. There are still people out there who think that just because someone within their immediate circle has not tested positive, that the virus does not exist. So it is very, very, very important that we share our stories so people know that it is real. My guest today is Prosper Senyo Sokpe. He's a member of the Ghana Association of Medical Laboratory Scientists. Good morning.
Yeah, Prosper. Good morning.
How are you?
By His grace, I'm fine.
Thank you so much for being with us. First of all, you're so brave and bold to want to share your story with us. Tell us a bit about yourself before we even get into the topic.
I'm Prosper, as you earlier said, Prosper Senyo Sokpe, a member of Ghana Association of Medical Laboratory Scientists. I'm also a Deputy General Secretary of the Medical Laboratory Professional Workers Union. I think somewhere last year, there was a pandemic. Mm-hmm. And then when you look at the country, you realize that we do not have proper or modernized laboratory system in the country. So I think that sometimes we use CT as a medium to propagate that there is a need for a laboratory policy that will see to the activities, how to run our laboratory system in Ghana. But we've been fighting this for years, and if you look at a country more than 60 years plus of independence, doesn't have a policy that controls the most important part of the health sector. Yeah. It's a pity. Mm-hmm. When the pandemic came, it was only even one. That's a research lab.
That's one lab.
That's one lab that at the moment was able to even detect the virus, and then were able to, when the first virus came, that's Noguchi. It's a research lab, around March. I think that as the cases begin to rise up, they don't have much personnel over there. So Ghana Health Service and MOH, they approached our association and wanted us to go and help them so that the cases, there were a lot of cases, so that it could reduce. So our leader then, our former president, Dr. Ignatius Abouhuni, came and then talked to us if we are willing to volunteer and go and support our other counterparts at Noguchi. I thought that is a new challenge that I wanted to also venture in. And then,
weren't you scared? Because some people would have been like, yes, I want to be a medical laboratory scientist, but I didn't sign up to, deal with a pandemic that can kill me.
Yeah. I realized that if I do not help and the thing begin to spread like how it's happening in Europe, it might affect me or affect a relative or affect someone that I dearly loved. Yeah. So I thought it was that if we are able to rather calm down the situation, then it's going to help us so that it can reduce the number of cases.
How did your family and friends react to that?
Yes, even on the page when I volunteered, I had people PMing me and asking me whether I am okay.
Were they also?
They're also part of my. They're also part of my colleagues, my other colleagues. Some PM me.
Have you lost your mind?
Yes, and they were asking me, is there money involved? And I'm going to this thing that people are running away from. Yeah. How come I want to go and go and do that? It's not advisable. Yeah. And I gave them that if we do not fight, if we do not help, it will come and hunt us back.
And what month was this?
That was in March.
So that was March. We
Yes.
didn't know what was going to happen in Ghana. We saw people died in Italy,
Yes.
in the US. People were predicting that Africans would die
Yeah.
in our numbers. And you
Yeah.
were still bold enough to say, I'm going to go.
Yeah, so I spoke to my dad then, and he said no. I spoke to my auntie. After my auntie, it was something else.
Did they think you wanted to just commit suicide or
They said they
something?
don't understand why people are running away from the virus, and I want to go to where people are running away from. And at a point, I began to think, because it's like the people around me
Yeah.
are telling me other things. I gave a thought, and I told them, even if I'm in a diagnostic lab
Yeah.
and the disease, people come. People are sick and they come. Someone could also come with the virus, and I could also contract that disease, and I
Yeah.
can also die.
Yeah.
So I told one of my colleagues that there are two things involved. It's either I get the virus and I recover, or I die.
Yeah.
Then he said, okay, I should give it a try. So I have volunteered. I think that the first day we got to the place, the facility, and it
Is
wasn't
it
easy.
still Noguchi?
Yes, Noguchi. I saw it. In my mind, I said, hey, this thing, is it going to work? So we had Dr. Kofi Boni, who came and gave us the orientation
Yeah.
and tell us how the virus behaves, what is going on, that still the virus is still under study and that kind of thing. So we're taking round. I watched the whole thing. I couldn't. Then that day, Professor Ampofo came and said that very day that they need people to start work that very day.
Your first day of
Yeah,
work,
first
your
day.
orientation. Not even
Yes.
first.
And then Dr. Ignatius Boni said no. He can't give his soldiers out when they are not prepared.
Yeah.
I understand him, because the work needs to be done. At first, I told one of my colleagues, should we try? And then later he said, no, let's go.
Like, try what?
Should we
On your first
go
day?
and wear the thing and start something? I said, no. So the Sunday, the two of us, Marjorie, we agreed to come and see what is going on.
Wow.
So we came. Even though there was some kind of fear among, but so far it's a pipette and it's a sample. And this is what we have been doing for long, even though it's not as in the part of the virus, but if we can be able to pipette or do those things, then we can do something. So we
And what's
went.
the pipette?
Oh, it's just a device that I use in picking
Picking
the
the-
samples. So I agree. Then small time I'll go to her. Is everything okay? I say yes. So the very day we were given the sample, and then we were told that these are pools. It's like they add
Yeah, you
maybe
pull it
number
together.
number of 5 people will add their sample, a certain volume.
Yeah.
And then I said that pool was positive. We don't actually, you won't know which one, which of the samples. That's why we have to individually separate them again.
Because at that time, you didn't get that machine that you put them all together at once.
No. So because the sample were a lot, so
Yeah.
that's from the starting. That's
Yeah,
what we're
you're
doing.
using.
So when I put the sample into the hood, then when they just told me that some are positive samples, when I was in the hood for more than 2 minutes, I couldn't touch anything. I was just inside and I could not see anything.
Yeah.
I was just there and say, hey God, which of them is positive? We don't know. Then so small time when the sample touched my hand, I'll take the 70% alcohol. I'll just spray.
But of course, you had gloves on it.
Yes, but the fear was there.
Yeah.
So I was able to gather courage. Within some 5 minutes, I was able to
Wow.
hold myself, and then we started work and became like a normal routine work that we were doing. So we're doing those things from March until November.
How did it feel? Because from March to November, some of your colleagues
Some left.
left. Some people were complaining that they didn't get the packages. What made you decide to continue on?
I think that our leader, Dr. Mrs. Boni,
Yeah.
Reverend Boni, was he's a leader, he's not a boss.
Yeah.
He kept on encouraging us and asking us to just give our best. Even though we knew that even though we thought the allowances and things could come on time and it wasn't coming. Because I wasn't made from the beginning that I would be paid before I went. We went before we had the announcement.
You even went when it was free.
Yes, we went.
To come work for free.
Yes, we went because it wasn't the first time. It wasn't because of the money.
Wow.
But it was because I wanted to try a new environment and look at how things also worked and be able to also help other people. So I did that. But along the way, I lost my dad.
Wow.
Yeah, on the
I'm so sorry.
Yeah, on the 28th of June. I was supposed to be for night duty, and then it was a sad moment. I realized that when it happened, one of my cousins is a doctor, so he asked us to pick his sample. So it didn't happen. It happened in Volta. So I called my colleagues over there, and they were able to pick the sample, and we ran it. It was positive.
Oh my God.
And at the moment, I felt like giving up because I thought I could have helped him, but I realized that the power was not within me to do whatever that was happening. So I accepted the challenge, and I still continue even though it's happened that way, because at times he used to encourage me that he knew I could do it. But I don't really go to him because I knew what I'm doing is not the best for him at his age. So it happened. So they have to do some other thing and then lay him, and then later on did the funeral. Then on November...
And I'm sure he's proud of you, because
not
everyone gets a son who's willing to selflessly, serve his country the way that you did.
Yeah, sure.
So what happened in November?
So in November, on 22nd, I started feeling cold, having some fever, having joint aches, muscle aches. The whole body was just hurting. And then I have this severe headache in my frontal. I couldn't move like this or go to the other side. I was just straight up. And then even though I'm supposed to test for malaria, I didn't do that. I just went straight up because how the thing was going, I just went ahead and do that. Even though I know it's not right, you are supposed to test before.
But you are a frontline
I'm
worker,
supposed to do that, yes. But where I was, and then I looking at going to queue, or I can call any of my mates to do that, but I think that it was bad on my part to do that, but it happened already. And I realized on the third day, I'm supposed to, I had malaria before. I know that on the second day or on the third day, if I'm on medication, I should be fine. But I was not doing well at all, and I started having diarrhea. So I called one of my colleagues, and I told him that this is how I'm feeling. And then he just told me it will be COVID, and I said no, it can't be COVID. And then he said I should come. So when I went, and then he swabbed my nose, and then they brought the sample. It was run. I went home. I couldn't sleep that night, so I realized that this is how the patients or the people who can, this is what they go through.
But what was going through your mind, especially since you had just lost your dad to this same virus?
Yeah, at the moment, I had two things in mind. It's either I survive or I die. And I know that there are a lot of people also that are also looking up to me that could be able to do something. But at that moment, it was, I couldn't have anything. There were a lot. Will this happen as my dad won't happen? Or will it happen as I see other people also going? Because along the line, we have a lab scientist also who is a contact tracer who also passed. So there were so many thoughts. But I just had some courage and then kept on moving. And when I went, one of Dr. Helena Lamte took that thing, and then he called. He called me. Normally I like joking around, so when he came, he said, "Oh, the thing catch you and I say, oh, it's not true. It can't be true. Then when I saw she was holding a piece of paper. So when I saw the code, I saw the lab ID. Then now the reality come now. I say, wow. Started thinking, and because I was also running and those things, so I spoke to my team leader, Dr. and Mrs. Bonnie, and he said, then I have to move to the hospital. So I left to go east. In fact, when I went, because I told them I was from Noguchi, that was the first time it was on 26th of November. The reception was good. The nurses there were kind. Things were fine. So I was sent to the emergency ward. The pain, I can't describe.
Wow.
It was, I don't know how to describe that pain. Giving all sorts of painkillers. It wasn't working. It's like as if the day I came, that was the same thing that is happening to me.
Wow.
I've been there for 11 days.
11 days
at the emergency ward.
And we're looking at pictures of you there. How did you feel? I mean, you've seen people who have experienced it, but for you to be there, admitted, it looks like you were even breathing through.
That was the second time.
Oh, this was the second time. So we'll get to the second time. But your very first time there.
Yes.
Being admitted for 11 whole days.
Yeah, 11 days.
How did you feel?
It wasn't an easy moment at all. There were so many, and I realized that the emergency ward was full. I went there first and I met a gentleman. We were two. I wake up and I realized that the room,
it's empty.
Like the room was not empty, now it was full. And I said, wow. So what is going on? So I started asking, but the authority kept on telling us the numbers are down.
Yeah.
But I was there and I saw it myself. That was even in November. I was surprised to see that the emergency ward was full. So I started thinking, so this thing is going on.
Yeah.
And we are not aware. Because I was at the testing center, I wasn't really paying attention to those things.
Because we were not testing
The
as
only
much.
thing I did is that I enjoyed putting the figures on my status. People come and ask me questions. How come the numbers are going up? How come it's happening this way? But I was just there. I didn't know. They were giving me some painkillers, injections and things. On the 6th of December, then I told them that I think I can manage with the rest at home if they don't mind. It's okay, I can do the remaining one. So I went to the hostel because we stayed there to go to work.
Yeah.
I stayed there and I realized that things were like the way I went. I was not okay. So when the 14th day was up, I went for a retest. When I went, they told me it was negative, but I was still feeling the same pain, the joint pain, the headaches and those things. So I can't mention the painkillers because I don't want someone to go and do any drug abuse. So when my medication, the painkiller got finished, the pain was something else. I couldn't.
Where exactly were you feeling the pain?
My joints were paining me. I was feeling feverish.
Wow.
My foot was as if nails or some kind of, if you grind pepper before, then some touches the back of your hand.
Yeah.
That kind of sensation that you feel, that's how I was feeling. So I sent a message to the director of the place because he gave me his contact that anytime I have any feeling, any changes, I should. So I called, but he sent me a message that he is in the meeting. So he asked me he told me we can't continue that painkiller for long because it also have some side effects. So I called Charles, that's one of my friend, my very tight friend. He is a lecturer at the University of Ghana. So I called him that this is what is happening. So he was campus. So the doctor sent me that. So I forwarded to him and went for the drug. Then the doctor asked me this time around to take 2 tablets in the morning. I did that. Around 4 o'clock, I couldn't stand it.
Pain was back again.
Pain was back. So I decided to go to a clinic that I used to work. I don't also want to really mention the name. So I got there And then when they checked my temperature, it was 39.1. And I realized that when they put the sponge, they sponge me or put a towel, wet towel on me, within some few minutes, it dries up.
Wow.
They continue giving me some IV of painkillers, antibiotics. Then I called my brother at VRA, Dr. Vermont, and I told him that I can't bear the pain anymore. And so I stood for some time. I told him, no, this pain is too severe, so I don't think I can do that. So he asked me to just hold on because it's the same. If I even come to his end, that's the same procedure, so they are on course. So the next day, it was still the same. So I called my team leader at Noguchi and I told her that I felt we should. Then the doctor came from the facility and said, "You think we should
do the test?
We should do the test again." So I called them and then he sent one of our colleagues. The team leader at Noguchi sent one of our colleagues. They came to swab me. So in the evening, then I was called. When I was called, then one of them told me, "Oh, it's positive." And I said, "Okay." I said, "Wow." So
How did you feel? Because you already had an inkling that you may still have it.
Yes. So actually, at the moment, I was down. And I felt so disappointed and I felt I couldn't fight this. So the nurse called the national ambulance and told him that I'm around and this is what was going on. At that moment, I couldn't breathe properly.
Wow.
So it's like as if the air around me was not enough for me to breathe. I did everything possible. I even removed my top. They were even asking me to cover. I said, no, the air isn't enough for me. So I can't stand it.
Wow.
And so when patients come, because I work there, they will know. Then I said, I don't care any longer because what was doing me, it's not about someone seeing me and then saying something, but it is also
fighting for your life.
Yeah. When they called the national ambulance, they were told they don't use the ambulance to carry COVID patients.
What?
And I said I didn't hear of any directive from leadership or the authorities saying that they shouldn't use the ambulance to carry COVID patients. And I told her I'm a frontliner. And I think I should be given a certain priority, but it didn't work out. So there are numbers at our hospital that deal with the COVID numbers, national. The nurse called the national lines to also. She was told they should treat me at my center. And I said, no. My center was not designated for treatment of COVID.
Yeah.
And I don't know, I can't stand that one. So I spoke to a few of my fellow lab scientists and told them what was going on. So I called one of my friends who is a lab scientist and we checked Rich. Rich said their beds are full.
Wow.
We called Kolebu. Some of my colleagues, lab scientists, are Kolebu. They said the place is also full. Then at the moment I felt that I've lost it because if where I'm supposed to receive treatment and as a frontliner and I'm not getting access, then at a point I feel like giving up. But the doctor kept on, Dr. J, he kept on telling me I'll be fine. I should just hold on.
What was going through your mind? You spent March till December sacrificing for this country.
I feel so disappointed.
And the time you need us the most.
Yeah.
National ambulance tells you they won't pick you up because you're a COVID patient.
Yeah.
You call all these hospitals, they are full.
I even told my team leaders, I told some other people, they try calling certain people in authority some of them couldn't pick up because of the time. It was around getting to 10, 11 there. So some of them couldn't pick up. Then we called UGMC. There was one of my mates is there, he's the head. We called, they said, they've closed down the COVID clinic at the UGMC. I said, I'm not aware. We've not heard them or announcing that they are no longer using the place, but we couldn't do it. And I said, okay, I've been at Ghanai's before.
So this whole time you're fighting to even breathe.
To even breathe. So at a point, I don't talk again because I felt that when I'm talking, the small oxygen that I need to to help me, that is what I'm used to. I stop. So it is now that my other lab scientists were also calling and finding out what the issues are and how I couldn't talk at a point. So I stopped using my phone. I couldn't do anything. So I stopped using my phone. And then we had a call. I have a friend, and he came, and then they picked me. We got to the entrance. It was hell.
Wow.
And he said, I've told the team over there that I'm coming. Are they aware of my coming? I said no. He said, I'm not also in an ambulance. So
didn't they see that you needed to?
Yeah, I even told them I'm a frontliner and I have a card. And this is the thing. It was difficult convincing them to allow me to enter. So one of them, they were 4. So one of them came that if it is true that I'm a frontliner, then they should allow me to go. I even mentioned that, I know Dr. Kwame said, unless I call. I said, look at the time.
Wow.
At this time, he will not be here. And these are our conversations. And he told me if any time I feel bad, I should just come. And they are aware. Most of the nurses are aware, but it was tough. I know it's their work they are doing. Maybe the directives or whatever were given to them.
But at that moment, you were fighting for your life.
Yeah,
you were running out of breath.
So the small energy I had, it wasn't easy. I knew that if I don't enter this place, I might die because of experiences I had and people close to me. So I did my best. And then the guy allowed us to enter. When I got to the center, I saw ambulances dropping off people from the airport. At that moment, I lost every trust or everything about the country. And I realized that I was even telling the nurses that from March till November, we kept on fighting so that things could be fine. And then here I am as a frontliner. They are able to designate an ambulance to carry those who test positive from the airport to the center. And the frontliner who is in Ghana, or it's because I am not coming from outside, that is why they are treating me this way. So there were other people who were trying, their relatives were there, and they were trying to say, so is that the country we are fighting for? At the moment, I was so disappointed that things could be this way. So some of the nurses, some of them knew me that I came there before, so they came and said, oh, since I'm not getting my breath, I should just hold on. The emergency room was full, so they arranged a place with a man. We went there, they gave me, then they took me to the ICU. When I got to the ICU, it was terrible.
Wow.
I couldn't breathe. The truth is that the team, Dr. Kwame team over there was just excellent. Whatever they have in their possession, that was what they were able to use for me. What was not there, they can't use on me. And at a point, people like came, the other doctors were at the back. If those who wear the PPEs are able, they are the only one that are able to enter. So I was the only one in the ICU. I started getting scared because when they said whether they should off the light or they should on it, I was so confused. And at a point I said, okay, it's like there are chillers in the room.
Mm-hmm.
And all of a sudden I was feeling I was feeling warm. I was feeling hot inside the room. They even reduced the chillers, like increased the chillers to 18. I was still complaining. I was feeling hot in the room. Wow. So they should open the windows so that I can have enough this thing. And I was saying, this is the last this thing on the chiller. I said, no, it's like I'm not okay. So they spoke, trying to tell me how things. I also listened. Then Dr. Kwame came and he asked me whether I believe in God, and I said, yeah, sure. The nurses, some came, Dr. Kwame came, encouraged me, came to pray with me, because at the moment things were bad. At a point, I can't walk. I was not able to walk. Yeah, I wasn't able to walk or move. They put I was on ECG machine for that 2 weeks. The oxygen level at level 15. It's as if the air was also too much on me, but I said that is the last level they could put me due to my condition. I said, okay. So the
you
nurses...
had to rely on an oxygen tank?
Yes, I was on oxygen for 2 weeks.
I'm sorry, do you have any pre-existing health
No, I don't have anything.
Because we are told that people with pre-existing health conditions are the ones who go through what you
No,
experienced.
Rana, those things have changed.
Wow.
It's not like that.
And what date was this specifically?
That's 16th December.
16th December.
Yeah.
We were still being told that the numbers were fine. People were getting ready to celebrate, Christmas. On a national level, no one could imagine that hospitals were full and that UGMC had closed because we were thinking that they've closed their COVID center because we were thinking we've beat the virus.
That's what they all say, but when you get to the ground, you realize that things are a bit different from what we've been hearing on radio and TV. And I think that at times, maybe those who are in charge do not tell the authorities what is going on because of fear of victimization. Even as I started this thing, I was told I'll be victimized and those things. I feel that Ghanaians must be aware and take the necessary precaution and just not be walking around anyhow and thinking that things are okay. Things are not really okay as it seems. And everybody and how the condition goes. And I don't want anyone to go through the challenges that I've gone through. That is why I've taken this upon myself to be able, the association try to support me just to be able to let others know that indeed the virus exists. It exists. Look, the pain, I can't describe the pain. I have never experienced such pain before, even with strongest of all painkillers. I was still not okay. That is why I said I don't want anyone, not even my enemy, to go through this kind of difficulty. At times, when I weary, I didn't know because I can't walk. Yeah. They have something they give to me and I weary inside. So I don't see. They come to take it out. Then one night, it got full. And then I had a bucket around. I poured it. And when I saw the urine, I became scared.
Why?
The urine was just like Coca-Cola.
What?
And the color, that's how it is. And because I'm a lab scientist, I know what was going on. So I started thinking, so many thoughts were coming up. At a point, I lost my taste. I couldn't eat. Wow. I couldn't smell for some days. After the food, they came. My friend has to come. They try. Water at times tastes sour, tastes bitter in my mouth. At times, the water tastes also too sweet. At times, the water tastes salty. I have to ask them questions, what am I drinking? But I knew it was water. And after the food, I couldn't. Wow. I couldn't eat at all because I lost appetite. And with time, as time goes on, I was asking if they could give me some medication that will enable me to eat. And they said, it's already in the drip. And I said, but I can't feel it because I'm hungry, but the food doesn't taste nice. Not that the food wasn't good, because just they brought me food from home, but it doesn't taste good. Yeah. The food is not nice at that moment. And then the shocking part was the medication aspect. That my friend came and told me he has been given a prescription to go and buy medication for 48 hours. And then when he came back, he told me for that 48 hours for that medication, it's 2,800.
What?
And I said, hey.
2,800 cedis.
Yes. And I asked, did you really hear the
price
the price very well? He said, sure. He went to the pharmacy shop, also was thinking it was maybe like 2.8 that he didn't hear well, but I said no. So he told me that the what he's having, he just only came to visit to see how things are going. So he can only buy at the moment, he can only buy the for 24 hours. That's 1,004.
Wow.
Then as time goes on, then we'll be doing that. Most of the medication that I used was purchased, and we spent over 15,000 just on medication.
Wow.
I thought
you guys were covered.
I thought treatment was entirely free. I realized they didn't have such type of medication in the facility, so it's not their fault that those medications were not there.
But especially for frontline health workers.
That was what I was also thinking, but since the thing was not there. So our friends, my association, Ghana Association of Medical Laboratory Scientists, the leaders and the past and the present leaders were aware. They sent something. My institution also, the administrator that was excellent. Some of the medication we have at our facility was also taken to that place for me to be used. The church also came in, Lighthouse, the Tertiary branch, Reverend Senyo. They contributed, they talked to other people. And then I have friends from Peter's Old Boys. They did also support. We have individuals who send money, my sisters, my brothers also, they support me.
My husband, this nation should do better, especially for people like you. And I want you to advocate, as sad as it is, at the time when you guys need us, because you put yourselves out there so that we can be safe. You shouldn't have to be reaching out to your church and your family and your associations to save your life. The country should show up and help you.
Yeah, because when my friend Charles realized that the amount he has on him wasn't enough, I think at a point Dr. and Mrs. Bonnie arranged some of my colleagues over there. They raised some little money, sent for medications. I think that, yes, as you said, we need to just be a little bit honest with the citizens about what is going on. If we have challenges, we should be able to tell the citizens our challenges so that the citizens can also be responsible and know how to live their life and live it very well. I know there are many out there today who still do not believe that the virus exists. Don't wait. If my salary can't even, a month's salary can't even pay for 48-hour medication, and then, I don't know, at the point I feel that the health sector needs to be really looked at again, especially the medical lab or the laboratories in Ghana.
Yeah.
Our incentives, salaries and things need to seriously be looked at. Our labs, some of the labs, when you enter, it's like as if it's a hen coop. Both the manager and the workers are in the same place, very tight. Some places have no equipment. Not that we do not have people with the brains to work. We have people who are well trained enough. When the issue came, we didn't import scientists from outside to come and help us do the work. We did not do that. That should tell the nation that indeed they have brains in the country. In certain countries, even well-to-do countries, you've realized that there were even doctors who moved even as far as Somalia to Italy. Is it not amazing? So we have the people that are there. It is not left with us to do the needful. The laboratory system in Ghana needs to be looked at. How can you be running a lab in Ghana and there are no policies to control the system or do the right thing? To me, it's a shame. It's a shame. As you are in City TV, you have policy that guides the running of City. Lab in Ghana does not have policy that guides us or do anything for us. We are just in it. We are just in it. And even in the management position, labs are not there. They are not representing the management position. We only hear people go for a meeting, come to tell us this is what was discussed in the meeting. You are not there to even make an input or even have a separate account to even manage the small money that has been generated. We generate a lot actually, but what comes back to us is just a little. That's why at times you will go to Kolibo, go to places, you can't do lab at the same time. Meanwhile, you have the scientists over there.
Yeah.
So I want to just tell Ghanaians that it is not a joke. It is never a joke that the virus is not there. Don't wait till you get to my... Maybe you will go, you might not come back. It might not be like my situation. I'm just urging each and every one of us that we should be serious in tackling this. If you see the cases now, today's on our 658 new cases. That is what we know. What about those at home? I personally know people who have tested positive and are home.
Yeah, there's a message here from Vanessa Thompson. She says she's very proud of you for standing up for medical laboratory scientists, and so many messages here of people who are so proud of you and are happy that you're safe. Is there a number that our viewers can call if they want to help medical scientists like yourself who are going through, a very tough time?
Maybe I just leave my number,
Okay.
but I don't know. It's that's 0249 88 9347.
Okay. Thank you so much, Prosper, for
Thank
being
you,
with us.
sir.
And I think from this conversation, the country we need to start having a conversation about proper insurance packages for our frontline workers.
I think
that
I
when
even
they
forget
test
about that
positive,
one.
Go ahead.
There are many especially even the contact tracers, that have not been paid. That's why many of them have stopped their job. At that point, you heard that there were even some demonstration in Kumasi about there are a lot of treatment centers that their 50% hasn't got to them.
Yeah, so we're going to champion this.
Myself is like that. There are a lot of us like that in the system. Even the insurance, some people went, filled the form. Since last year to date, nothing has been done to most of them. We don't know when that insurance will take effective. Effective day, we don't know.
We will definitely follow up and make sure that you guys get what you are owed, because you've sacrificed so much for this country, and we thank you for your service. Don't go anywhere, guys. Breakfast Daily.